Hello, this is Dr. Brett Diaz from Scoliosis Systems, and we're here today to talk about stopping and reversing scoliosis progression, how to reduce pain and avoid surgery. This webinar is brought to you by Scoliosis Treatment Alternatives and Scoliosis Systems. Now, today's topic is going to be examining the most common myths about scoliosis. We'll also look at how your spine should stack up and what happens to your spine in scoliosis. We'll also look at how what causes your scoliosis to progress and why puberty in particular causes progression. We'll also look at the vicious cycle of scoliosis and how it can cause your curve to worsen even in adulthood. And we'll look at what can be done to prevent and reverse these changes both in adolescents and in adults. And if you stick around to the end, I'll give you a free gift that will enable you to monitor your scoliosis progression at home. Now, a little background about myself. I'm the founder of Scoliosis Treatment Alternatives. I have a practice that focuses on alternative treatment for scoliosis. I'm the Director of Clinical Services on the West Coast for Scoliosis Systems. And the office locations that I serve for Scoliosis Systems are in Seattle, Washington, Vancouver, Washington, Denver, Colorado, Campbell, California, Studio City, California, and Irvine, California. We have a total of 17 office locations across the U.S., Phoenix, Arizona, Dallas, Houston, Atlanta, Chicago, Buffalo, New York, Ramsey, Raleigh, Tampa, and Miami, as well as 3 locations abroad. We have in Dubai, Saudi Arabia, and the Dominican Republic. All of our offices focus entirely on the alternative treatment of scoliosis to help avoid surgery and reduce pain. Now let's first talk about some of the common medical myths about scoliosis. The first myth is that once you're done growing, the risk of progression of your scoliosis goes away. But the fact is that 68% of people with scoliosis have their curves progressing after adulthood. And that's because once a curve passes 30 degrees, gravity takes advantage of it, and it can cause it to progress at an average rate of about a degree per year. And for women with scoliosis, there are 3 times in her life that she has to worry about the increased risk for rapid progression of her curves. The first one's during puberty, when there are a lot of hormonal changes in a period of rapid growth that can cause the progression of a scoliosis, and we'll talk in more detail about that. Also pregnancy, because when a woman is pregnant, she has a hormone in her body called relaxin, which is there to help relax the pelvic ligaments so she can pass the baby. But it doesn't just impact the pelvic ligaments, it affects all the ligaments in the spine. So if a woman has scoliosis and she's resting on her curves because if she's not doing anything to support her spine, then those ligaments can stretch and the curve can progress rapidly during that time. And the third time is menopause. When menopause hits, there are significant bony changes that occur as a result of demineralization due to the drop in estrogen. And this can be another time where there's a rapid progression of the curves. So as you can see, your scoliosis does have a significant risk of progression into adulthood, so it's important to get it stabilized as early as possible. So what can cause a spine to suddenly go from this to this? Well, there's several things. Obviously, the changes in the bones or the structure of the spine. The spinal column is a scaffolding which the rest of the bones hang off of. Also, that causes changes in the articular function. As the structure changes, the joints have to adapt. You'll also get then subsequent changes in the soft tissue function, the muscle and the fascia. The fascia is the connective tissue that surrounds all the muscles and will adaptively shorten around the muscles as they change. Also, you can get changes in your movement patterns, which involve your brain. Your brain actually makes changes based on the scoliosis. We'll talk more about that. And if left uncorrected, eventually the scoliosis can cause changes in the viscera, in other words, your internal organs, such as your heart and your lungs. So let's take, first of all, look at what an ideal spine looks at. This is looking at an ideal spine, and you can see here that the head is stacked evenly over the shoulders, which is stacked evenly over the rib cage, and stacked over the lumbar spine, the pelvis, and if you go on to the knees, ankles, and feet. Also, if you look at the vertebrae, or the spine, you can see that the vertebrae are all stacked evenly over top of each other. And that allows the body to be evenly centered over the midline. Now, if we take a look at the spine from the side view, you'll notice that there are three curves in the spine. You have a cervical curve in the neck, which goes forward, a curve in the thoracic spine, which goes backwards, and a curve in the lumbar spine, which also goes forward. And as you can see, too, that each of these segments are stacked evenly on top of each other, which is centered around the midline. Now, the importance of having your body centered over the midline in both these planes can't be overstated. The body doesn't have to work as hard if it's stacked up evenly. It's very efficient, and it doesn't cause any pain in this position. Also, the nervous system works best when the body is stacked up correctly. Now, let's talk about the scoliosis spine. One of the characteristics of scoliosis is you have curves where there shouldn't be and no curves where there should be. So let me explain that. First of all, the characteristic curve of scoliosis is the lateral curve to the side, where the vertebrae shift to the side, but they also do something else. They also rotate, especially at the apex of the curve. As the spine progressively worsens, the more rotation occurs in the spine. When we take a look at the spine from the side view, we notice that the lateral curves start to decrease. So you can see that have flattening of each of those cervical, thoracic, and lumbar spine. And this is especially true in the thoracic spine, where this phenomenon causes a flat back. Now, the loss of these curves makes the spine more susceptible to injury and pain, which is why people oftentimes develop pain later in life due to their scoliosis. So what causes this scoliosis progression? Well, if we start off looking at adolescence, we'll notice that the spinal column, which houses the nervous system or the spinal cord, during adolescence, right around the time of puberty, there's a rapid growth of the spinal column. And that growth of the spinal column outpaces the growth of the nervous system. So what that ends up doing is that ends up stretching the spine. Now, the spine is a nervous tissue, and it doesn't like being stretched. And so what happens is, as the spine gets stretched, the brain says, wait a minute, we've got to take the tension off of this. So it'll cause the spinal column to coil. That coil will occur in order to decrease the distance between the skull and the sacrum, and thus decrease the tension on the spinal cord. And that coiling will continue until eventually the tension gets off the spinal cord. Now, a second thing that can cause progression of the scoliosis is something called the vicious cycle of scoliosis. This describes the events that occur that can cause progression in the spine, and they are a general cascade that will occur. The first one is called a genetic predisposition for growth modulation. In other words, there's a delay in growth on one side of the vertebrae. If you take a look at the photograph to the right, you'll see that the vertebrae with the two circles are showing the two different growth plates that are on the right and left side of each vertebrae. Those growth plates, normally as the spine grows, they'll grow rather synchronously. In other words, one side will grow and the other side will catch up. One side will grow and the other side will catch up. And they'll continue to do that until eventually they reach a mature length, in which time they stop growing. But with scoliosis, what happens is, because of a genetic predisposition, you'll get a delay in the growth on one side of the growth plate. And that's what causes the initial tipping. So that genetic predisposition for growth modulation causing that initial tipping then causes what's called localized 3D vertebral deformity. Now, we just talked about the lateral wedging of that vertebral deformity causing the lateral deviation, but there are other deviations that occur. There's also an anterior to posterior wedging that occurs, which causes the flattening of the normal curves, especially in the thoracic spine. Also, you can get a rotational distortion, which causes twisting of the torso, and that's what can cause the rib hump, and we'll explore that a little bit later. That localized 3D vertebral deformity will then result in destabilization of the spine, which affects all the joints, not just in the spine, but in the rest of the body. Now, if we take a look at as the spine progresses, you'll see that the primary curve has the greatest potential to progress because that's where the initial deformation is, and that's where the most stress is. As the spine continues to progress, then the rest of the body has to adapt. For instance, in this case, our brain requires, in order to balance ourselves, that our eyes remain on the horizon. And that's the righting mechanism that causes our body to adapt to allow that to happen. So if that occurs, that can cause a secondary or compensatory curve, which is less likely to progress than the primary curve, but still must be addressed when treating the scoliosis. Also, that there's destabilization of the rib cage that occurs, and you can see in this case on the outside of the curve, as the rib cage rotates backwards, causing a rib hump, you get splaying of those ribs. And on the inside of the curve, you're going to get the curves rotating forward, and they get compressed, causing a flattened zone. This too must be addressed in scoliosis in order to help reduce the adaptations that occurred in order to help improve the curvature. Now, when we take a cross-sectional look at a normal spine, you can see the normal spine here in the middle and the cross-section of the rib cage in the center. You can see that the ribs are normally very symmetric from right to left, and the vertebrae are right in the middle. As the scoliosis occurs, you get that rotation that we talked about, and that rotation then causes the rib cage to rotate with it. So it creates a flattened area on one side, in this case on the right side, and then a rib hump on the left side. And that's a 3D vertebral deformity that occurs as a result of destabilization of the spine. Now, that destabilization of the spine will lead to postural disorganization, and that involves the brain. Now, postural disorganization affects more than just the spine. It affects all the tissues that connect to the spine, as well as the muscles and ligaments. And depending on where that particular scoliosis lesions are, will depend on where the curve pattern will disorient. For instance, you have different curve patterns that you can see here. We got a thoracic curve, a lumbar or a double curve, a thoracolumbar curve, and a lumbar curve. Each of these is going to have a different postural disorganization based on where the primary and secondary scolioses are. That postural disorganization of the brain will then lead to neuromusculoskeletal dysfunction. Now, neuromusculoskeletal dysfunction will first occur, obviously, in the muscles. So let's take a look at the muscles, not only in the spine, but also in the structures adjacent to the spine. If we take a look at the relationship between the shoulder girdle and the rib cage, if I remove the muscles surrounding the shoulder girdle and the rib cage, you can see how the shoulder girdle is directly over top of the rib cage. As the spine rotates, it carries the rib cage back with it. And as that occurs, that pushes the shoulder girdle out of the way, causing the shoulder to rotate forward. If we take a look at the front side of that same shoulder, we also notice that as that occurs, the muscles in the front will have to adaptively shorten. So you get the pectoral muscles in the front adaptively shorten, pulling the shoulder forward. Now, these areas also have to be treated in order to help improve the scoliosis. If we look even further deeper in, we'll see that the deep postural muscles called the multifidus also adaptively shorten and weaken on the side of the concavity. So as the spine rotates, those muscles will adaptively shorten. And if you take a look at the other side of the thoracic cage, you'll notice that the postural muscles, or the core muscles called the abdominal obliques, will also have to adaptively shorten. These muscles will adaptively shorten and must be treated as well in order to help move the body back into a more corrected, derotated, and aligned position. Also affecting in the neuromusculoskeletal dysfunction is the brain map of the body. As the spine starts to adapt and the muscles start to adapt, the brain has to determine where the body is in space. So it will develop a map that is not correct. In other words, the brain map will think that the patient is aligned when in reality the patient is not. And I see this quite often when parents bring their children into the office, and oftentimes they'll say, I'm always telling her to sit up straight, to which she replies, but I am. And the reason for that is because in her brain, she is sitting up straight. However, in reality, she's not. So what we have to do is, in order to treat the scoliosis, we have to teach her where the new normal is, where the corrected position is, which initially is going to feel very odd. But as she learns that, she'll then be able to direct her body back into that corrected position. Also, the neuromusculoskeletal dysfunction leads to further asymmetric biomechanical growth plate loading. In other words, the growth plates on the inside of the curve get stunted even further due to the constant pressure from the progressive distortion. That leads to rigidity that develops on the compressed side, causing stiffness on the inside of the curve, as well as instability, which occurs on the outside, causing hypermobility. All of that leads to further growth plate loading. And if left uncorrected, then that asymmetrical biomechanical growth plate loading will lead to further localized 3D vertebral deformity, which causes more destabilization of the spine, which causes greater postural disorganization, which adds further neuromusculoskeletal dysfunction, which leads to even more asymmetric biomechanical growth plate loading. That's why it's called the vicious cycle of scoliosis. It feeds on each other unless left uncorrected, or if left uncorrected. So in order to stop this vicious cycle of scoliosis, we need to break each of those patterns. So let's take a look and see. We can't really change the genetic factors for growth modulation. That's something that you're born with. But we can change the epigenetic factors that are contributing to this gene expression, and I'll explain that in a minute. Looking at the localized 3D vertebral deformity, treatments such as Spinecore and New Schroth can help move the body back toward midline to help that delayed side catch up. Now, Spinecore is called a dynamic orthoses, is a technical name for it. It's also known as a scoliosis brace, but I hesitate to call it a scoliosis brace because it's not like your traditional scoliosis brace that's that hard plastic shell that's like a body cast. The problem with static braces that are the plastic kind is that they immobilize the spine much like a body cast. And anytime you immobilize a body part, you're going to tend to get muscle atrophy, which is a problem because you already have a muscular imbalance to begin with, so it'll cause the weakened muscles on the inside of the curve to weaken even further once you remove the brace. But Spinecore is very different. It's made of elastic bands that wrap around in the body in different configurations based on your curve pattern. So while you're in it, you can move whatever direction you want, but it gives you a constant reminder, no, go this way, and that's into the direction of correction. It was initially developed for adolescents, but it later became adapted for adult use as well. Now, the way the Spinecore brace works is that it helps move the body into the direction of correction. If you notice the illustration to the left, you see that, or the photograph to the left, you'll see that this patient's body, this patient with scoliosis, her body shifted to the right. And if you look at the x-rays, you can see the curvature also shifting to the right. But the Spinecore brace, based on the particular setup, will help move the body into the direction of correction at the apex of the curve, thus helping reduce the curve and retraining the body to allow for this new normal position. Another thing that we utilize to help improve scoliosis is the Schroth method. This helps improve 3D vertebral deformity by elongating the spine in the adaptively shortened correction. So we'll talk more about that in detail a bit later. So if we can help correct the localized 3D vertebral deformity, we can help improve the scoliosis. Next, let's look at the destabilization of the spine or the joints. Now, if we take a look at Schroth breathing, the Schroth breathing helps the person breathe to help move the rib cage into the direction of correction to help move it back toward a more normal position. So we teach something called directional breathing, which helps the body do that. And that also, because the rib cage is connected to the spinal column, can help derotate the spine as well. If we can improve the destabilization of the spine, we can also look at improving postural disorganization. And the treatments that we use to help improve postural disorganization are, again, the spine core brace, because the spine core brace has different setups depending on where the curve is. And we talked about this before. For instance, a thoracic setup will help move the thoracic cage back in fine. A double curve has improvements for both the thoracic and lumbar curve. The thoracolumbar curve improves right at the junction of the rib cage and the lumbar spine. The lumbar curve also has a slightly different setup that affects the lumbar spine. There's even setups for something called hyperkyphosis, which is also known as a hunchback. It's related to scoliosis, it's just that the curves are in a different direction. But depending on the curve pattern will depend on how the setup is for the brace to move the body into the direction of correction. Now, another thing that can help improve the midline is the myofascial release to help open up this particularly adaptively shortened muscle tissues. And it has to be directed toward the specific muscles that have adaptively shortened. In this case, we're looking at the rib cage on the concave side in order to open that up and relieve some of the stress to allow the body to move back toward the midline. Improving the postural disorganization is important, but also as important is the neuromusculoskeletal dysfunction. So we look at doing that with also the spine core brace, because the spine core brace is, as I mentioned earlier, is considered a dynamic tension orthosis, meaning that it moves with the body. So it provides what is called corrective movement therapy, meaning that the brace has its greatest corrective action while you're moving. And what it does is it helps the brain develop new patterns of movement that are corrective. So as I said before, while you're in it, you can move whatever direction you want, but it gives you a reminder, no, go this way, and that's into the direction of correction. And that helps recalibrate the brain to the new corrective position over time, allowing allowing for better muscle memory or corrected muscle memory in the new normal position. Also, Schroth dynamic movements help establish this in the brain. By performing the dynamic activities while maintaining the corrections, helps the brain integrate these changes throughout the course of the day. And it's important to do these slowly, especially in the beginning, because this allows the brain to adapt those new patterns of movement to replace the abnormal default patterns. Also, using mirrors is an important piece because mirrors help position the body and reinforce these new movement patterns, especially in the beginning when the patient is very unaware of their abnormal movement patterns. And the reason that helps is because neurons that fire together wire together. So in other words, as you're feeling the movement in your body, you're seeing it in the mirror, and you're able to see that those are occurring correctly. This helps create neuroplastic changes in the brain itself that allows your body to recalibrate the new spinal position in your brain. And that's what allows those changes to remain permanent, because it's not a brace, like a hard brace, that holds you in position that allows that to happen, because that doesn't help, because once you remove the brace, the spine goes back. Because it's your brain and your body making these changes, once you remove the brace or once you do this, those changes will stay in place. So the neuromusculoskeletal dysfunctions and the improvements with the treatments for the brains and muscles also helps improve the asymmetric biomechanical growth plate loading. For instance, the Schroth exercises, they help elongate the spine, and elongating the spine helps lengthen the adaptively shortened tissues, and this unloads the growth plates to allow for the delayed side to catch up. Also, directional breathing into the flattened zone further enhances correction, opening up the restrictions on the inside of the curve. And again, using mirrors helps you improve the sensory motor awareness so that you can feel the changes in your spine while you see them at the same time, and helping your body return back toward the midline position and by activating those particularly shortened and weakened muscles. Now, the spine cord tension orthosis also does a similar thing. By moving the body into the direction of correction while it's being worn, spine cord has the greatest corrective action while moving, and moving the body back toward midline helps that delayed side catch up, both in the postural and the structural component of the curves, especially with patients that are still growing, because if they're still growing, we can help that delayed side catch up. Myofascial release also helps with this biomechanical growth plate loading. By addressing the core and peripheral tissues that have adaptively shortened, we can help improve the mobility at the apical segment into the direction of correction and not into the opposite direction. So again, it's very important that the specific structures that have adaptively shortened only be treated. You don't want to treat the muscles on the other side because that will lead to the curves increasing. But by stretching the affected muscles and tissues that have adaptively shortened in the trunk and extremities, you can help restore a more balanced pattern of movement. So if we can stop the vicious cycle of progression, we can stop or vicious cycle of scoliosis, we can stop scoliosis progression. We can also help improve the postural component of the curve, which can help reduce the degree of scoliosis, and that's true even in adults. And that's because every scoliosis has both a structural and a postural component. In adolescence, we can help impact both the structural and the postural component. And in adults, we can help improve the postural component, which is usually where the pain occurs. So in other words, we're not going to get rid of the scoliosis completely, but we don't have to. We have to just improve it enough to help the body move into the direction of correction to relieve the compression of the nerves and then the strain to the joints, and that helps relieve the pain in adults. So how do you know if you need treatment? Well, obviously pain is a good indicator. If you have pain related to your scoliosis, then chances are you should seek alternative treatment before seeking conservative treatment. The problem with conservative management is that it's very limited. Also, if you're seeing any progression of your spine, whether you're an adolescent or an adult, or especially if you're an adolescent, it's time to get in and at least have a consultation for alternative treatment to see if we can help. Also, if you want to reduce your curves, that's an important thing to do, and alternative treatment can help with that. So how can you determine if your scoliosis is progressing? Well, if you're seeing further distortion of your body symmetry, then chances are you're having progression of your curves. But that's not a very objective way. The most objective way of determining if your scoliosis is progressing is looking at the Cobb angle, which is a measurement of your scoliosis on X-ray. But there are other ways that you can monitor your scoliosis, especially during adolescence. And the first is the way you can monitor it at home is measuring the angle of trunk rotation with something called a scoliometer. Now, the ATR is something that doctors have used to both screen and monitor a scoliosis over time. This is a scoliometer, and it's measuring the angle of trunk rotation. And you can see it's a handheld device that doctors use, and they run it along the back of a patient. And in this case, you're seeing 11 degrees of clockwise rotation in this patient's spine. Now you can measure the angle of the trunk rotation at home using a scoliometer app. The great thing about smartphones is that there's now an app for everything. And so there have been several apps developed for scoliometers. So you can use your smartphone at home in order to measure the angle of trunk rotation in either your child or yourself. Actually, you'd have to have someone do it for you. But in order to do that, you simply pull up the app and you run the smartphone down the top and bottom of the back on each side, and you record the highest reading for each of the curvatures. Now, I've done a review of these scoliometer apps, and it's on my website, scoliosistreatmentalternatives.com, and review of scoliometer smartphone apps. And it reviews each of them, the features, the benefits, and what's good about each of them. Now, as I said at the beginning, for staying to the end, I want to give you a free gift. And so I'm going to give you a home scoliosis assessment package. And this home scoliosis assessment package includes a parent's guide to scoliosis, which is a practical guide for identifying early signs of scoliosis and treating so that you can nip progression in the bud. You'll also receive a user instruction guide for proper use of a scoliometer app to teach you how to use it properly so you can make sure that you're doing it correctly at home. Also, we'll evaluate your scoliosis x-rays to determine the Cobb angle if you send us a digital photograph of that. And we'll give you a free phone consultation with one of our doctors, one-on-one, to review your scoliosis to see what type of treatment might be best for you. And you'll get all of this for free simply because you've attended this seminar and watched it to the end. Now, these are the locations that we have across the U.S. As you can see, we're located in 17 different locations in the U.S. If you'd like to see our calendar for each of these locations, you can go to scoliosissystems.com and click on the calendar. So I'd like to thank you